A lot of people sometimes say to me, I'm really afraid. I want to get this done, but I'm afraid and I'm not going to go through it. I'd rather stay the way that I am. Well, we have a solution for you. And I want to introduce you to, as we say, new character unlocked, Dr. Roy Berenholtz. Say hello to the camera.
Hey there.
So, Dr. Berenholtz, introduce yourself.
Yeah, so I'm a board-certified pediatric and adult anesthesiologist. We do many cases here under sedation. Patients are, for our first priority, safety. We keep the patients monitored. We have end-tidal CO2, full EKG. They basically are moderately sedated. They go through.
What does that mean, moderately sedated? They're awake? They're sleeping? What are they doing?
So moderate sedation basically means that they're sleeping. They're not feeling any discomfort while the surgery is going on. They're pretty much sleeping, not aware of what's going on when they wake up.
Will they remember anything?
No. So part of the sedation is also amnesia. We give some medications that work on memory, so they don't have any recollection of the intra-op experience.
So they're responsive. They're able to breathe on their own.
Breathing on their own. Nasal cannula. We give them oxygen through a nasal cannula. They're breathing on their own. They're not paralyzed. It's not like a general anesthesia where they're fully paralyzed and put on an anesthesia machine. And patients they just love it. They're very comfortable. They're safe. We get great feedback from the patients. Comfort level. Yeah.
The beautiful thing is that sometimes you may go to another office and say, okay, well, I need to have sedation done. And typically these cases, whether it's 1 arch or 2 arches, can take 6, 7, 8, maybe 9 hours sometimes. The beautiful thing about our process is that probably the longest case we ever had was maybe 3.5 hours, average 2.5, 3 hours.
Yeah, about 3 hours per case.
Wake up, go to sleep, 3 hours, and they're up, and someone will take them home.
Yeah,
but they can walk out on their own.
Right. So basically, the requirements for once the patient gets sedated, they must have an escort taking them home. They're fully awake when they leave, but there's still anesthesias in the system, so it could affect their balance or their coordination. So recommended to have an escort with them on discharge. But yeah, they're fully awake and coherent when they leave here.
So you would say, if God forbid you're not going to need this, but if you ever had to have this procedure that we do every single day, sedation is the way to go?
Oh, for sure. I can't imagine people doing this without sedation. It's a lot of involves drilling and just all the whole dental work.
It's a lot.
It's a lot.
I would say mostly maybe not even like the quote unquote the pain, but the emotional part of it, right?
Right.
Sometimes we see a lot of patients that they, while we're doing it, we're not even doing anything, and they're very emotional because this is something they've been thinking about for a really long time.
Right. Yeah.
And this allows us to control that.
Right.
Yeah.
So like I said, part of the medications we give also involves anxiolytics. So it's not just putting them to sleep, but it's also taking away their anxiety. So they just go into this experience. It just changes the whole thing compared to a patient who's not sedated. And I see the difference. I see sometimes patients in other offices prefer not to get sedation for some other reasons, and it's
crazy, right?
It's a night and day difference.
As an MD,
patient satisfaction, and again, you got to put the risks and benefits. When you put it on the scale, it's a very safe anesthetic. Again, we're not intubating the patient. It's a mild to moderate sedation. The patient is breathing on their own, fully monitored. We have an end-tidal CO2, which allows us to see their breathing, their oxygen level, their heart rate. I mean, it's a full anesthesia monitoring, but yet it's not general anesthesia. So it's very safe.
It's amazing that, in dentistry, we do all of these really intricate, small procedures that require all of this precision, and we expect the patient not to move. All of these years we've been doing dentistry with the patient wide awake, and it's kind of traumatic in a sense. And
it's a lot of for our patients.
It's a lot. In the medical world, it wouldn't even be like an option. Of course, you're getting sedated. We're not going to put you through
a procedure, and I mean things like colonoscopy when there's no incision and there's nothing. It's just a scope. You need to get a sedation.
So, if you are afraid, if you've been afraid, if it's something that's been holding you back because you're not sure how you can make yourself go through this, just come to the office, meet us. Dr. Berenholtz will be there to be able to make this procedure as comfortable and the first part forgettable for you, but you don't have to let that part stop you from having the teeth and the smile you've always wanted.